Skin testing is normally performed on the volar surface of the forearm and/or on the back. Sanitize the test sites with alcohol swabs. There should be at least a 3 centimeter separation between each 10-spot test site to prevent overlapping and causing difficulties in interpreting the results. Proper contact between the skin tester device and the skin is required to ensure that the antigen-bearing tines of the device puncture the epidermis to deliver the antigen to the underlying reactive dermis layer of the skin. Proper test technique, however, will not cause bleeding. Remove your skin test applicator from the well tray and briefly inspect to ensure that a small amount of antigen is present at each tip of the device. Holding the applicator perpendicular to the skin and with the arrow always pointing to the patient's head. Press down with a moderate pressure. To ensure that all tines puncture the skin, you may rock the device from side to side, pushing firmly but without excessive pressure and without lifting the device or allowing it to shift. When properly performed, the test will leave visible marks on the skin without causing bleeding. Discard the used device into a suitable biohazard container. Recover the well with a new device as soon as possible to avoid contamination of the antigen wells. Do not reuse the devices. They are not made for autoclaving. Read the wheels from the test by measuring the diameters as with the AllergyEasy measuring device and give the patient a copy of the test sheet for his information. You might occasionally come across a patient who is not taking any antihistamine or asthma medications but shows little or no reaction to the allergy test at all. While other allergy programs might turn these patients away, we do not. If this patient has significant symptoms, it's safe to assume they have allergies, even if they have a negative test. Remember that allergy tests are quite accurate, but they are not foolproof. Start these patients at the standard 8th dilution vial pack. The mixing of the 8-pack can be completed with 8 easy steps. These steps can also be found in the Technician's Guide section of your training manual. 1. Place the AllergyEasy diluent vial on your mixing table. 2. Place the 10 cc vial labeled FAC Comprehensive Mix to the right of the diluent. 3. Place the vial labeled 8, the largest vial in the startup pack, to the right of the 10 cc vial. Now, place the vial labeled number 7 to the right of that, and the vial labeled number 6 to the right of that, proceeding on down with the labeled vials until all the vials 8 through 1 are on the table. 4. With a 10 cc syringe, remove 2 cc from the 10 cc vial and place that into the vial labeled 8. 5. Place 10 cc of the diluent in vial number 8. Then place 4 cc of the diluent into vial number 7. And another 4 cc of diluent into vial number 6. On down to placing 4 cc of diluent into vial 1. 6. Remove 1 cc from vial number 8 and place it into vial number 7. Pump the syringe a few times to mix the new dilution. 7. Remove 1 cc of diluent from vial number 7 and place it into vial number 6. pumping that before drawing 1 cc to place in vial number 5. Repeat this until vial 1 has the added serum. Eight, insert dropper tips and caps in all vials. You can reference these steps in the technician's guide of your training manual. Once the patient has completed his startup pack, he will return for a maintenance vial. Simply remove 2 cc from a 10 cc FAC comprehensive mix vial and place it into an empty 10 cc vial labeled maintenance, then add 10 cc of diluent to the maintenance vial and pump the syringe to mix. Insert tip and cap. Remember to write an expiration date on each vial. The date should be 1 year from the date of the mixing. When the test is finished, record the results on the test recording form. Make a copy for your patient to take home. Point out to the patient those antigens that they have the most severe reactions to. Once you have completed the testing and mixed up the serum, it's time for the patient's final instructions. Give the patient their startup pack and explain the corresponding dosage schedule. Show them how to administer the sublingual drops, either directly under the tongue or into a spoon to be transferred under the tongue. The better a patient understands the program, the better the odds are that they will comply with the program and experience success. Schedule 2 follow-up appointments to track the patient's progress, one at 1 month from the testing date and the other at 3 months from the testing date. Remind the patient of general instructions, such as not administering the drops for 5 minutes before or after eating or drinking, and storing the serum at room temperature. Explain to the patient that they will need to call the office 1 week prior to finishing the initial serum series to order a maintenance vial. Patients should continue taking maintenance serum for at least 3 years to make the desired changes to the immune system. Refer to your training manual for all the important details on follow-up visits, adjusting patient serum for seasonal allergy flare-ups, and restarting patients who have dropped off the serum. Thank you for taking the time to learn more about immunotherapy with AllergyEasy. We know you will find it to be time well invested, and you will find great satisfaction in helping your patients finally find relief from allergies. If you have any further questions about the AllergyEasy program, feel free to contact us via email at contact@allergyeasy.com or through our toll-free phone number at 1-877-2-SNEEZE. That's 1-877-276-3393.